What I'm also going to demonstrate now is how to incorporate essential oils into not only this kind of treatment that I'm doing, but also how you can incorporate essential oils into purely a Bowen Therapy treatment. So I'm going to go ahead and start and talk about this while I do it. What I'm doing now is basically just applying a thin layer of oil directly on the spine. I'm not doing a massage here, I'm literally just applying a layer of oil onto the spine, or the area of the spine, from the erector spinae up to the neck here. And this is for a protective barrier for some of these oils that I'm about to put on the body. Some of the essential oils that you can use are actually quite heating. That for certain people they can be quite agitating, depending also on what oil. So this is where you get to learn oils. For those oils a bit more. For those of you doing the diploma course, I've added information on essential oils. So learn from these oils, and so this is also going to cover this a little bit for you, but also cover for you how to do a treatment with these essential oils. So what I'm going to do here is now get some oils for my client. I'm going to use a bunch that I feel are going to be relevant for his body type and for the treatment I'm trying to do. He's got a lot of tension there in his back, and it feels quite easy, it feels quite tender, but it also feels quite inflamed to me. So instead of using potentially something that might increase the inflammation or maybe bring more heat to this area, I feel it might be a bit more heat agitated than it is cold, because I can't feel any coldness in his body, so I'm feeling temperatures. So for me it feels like I'd rather put a bit of cooling oils on his body instead of heating ones, and this is where knowing your oils comes into play. So far I've got out lavender. It's a very cooling oil. I'm not going to put that one first though. I'm going to put bergamot on first. I'm in Melbourne here, and it can be quite cold down here, especially in winter. Even though I've got a heater running right now, my room's really warm. It takes a while for the oils to get room temperature. So with bergamot, you could potentially use about 8 drops of oil. You're not going to have to worry so much about contraindications with this oil. So what I would typically do, and I'll show you this just so you can see how someone in a warmer climate might do this, or how I did this when I used to live in Sydney. I just drop it on the spine like that. Now, it's not that cold today, and I've had my heater on all day, but if I'd done that in the morning, my first client, it would be freezing and they'd be getting a shock to the system. So that's why I apply it on my fingers first and then rub it on the back. And then once you've done that, you're going to be doing these nice figure 8 moves. What I'm using here is the pads of my fingers, and I'm really just moving around this oil. I'm not doing a massage here. I'm just distributing this oil across the spine and using figure 8 type moves, or an infinity symbol move. You can see you just got goosebumps then. You can get similar responses to what you might from a massage or Bowen therapy treatment. When you do moves around the neck or the scapula, you can get a particular kind of release, and often that's represented by people getting goosebumps. It happened then on his lower back. I'm doing this because he's quite sore in his lower back area and very sensitive to touch. So I want to use some of these essential oils to potentially help relax his body and muscles and help with the treatment. I'm going over here now to get something a little bit more warming, but it's not too warming. It's still cooling and soothing, and this is chamomile. This is one of my favorite oils. This is German blue chamomile, so you can see how blue it was. This is one of my favorite oils, and this is 100% chamomile. So most chamomiles you'll find are 3% chamomile in jojoba oil or some other base oil, and it's usually just 3% chamomile. This one's 100% chamomile, so if you want to get a similar one to that, then try and find a Roman blue, a German blue, or there's other blues, there's Hungarian blue, but yeah, just look for blue chamomile oil and make sure it's 100% oil. It's very expensive, so don't be surprised if it's going to cost you in excess of $50 for something like 7 mil. Also, these figure 8 moves, try and keep them rhythmical. What some people do is make them too fast, and you can be going like this, and then some people might make them really slow, and it gets a bit kind of weird almost for the patient. And if you do it in this nice rhythmical motion, it will be typically the nicest thing. Of course, everyone's going to be different, but to what they like, but it's generally a good pace to go. Also note that I'm going from the center of one of the erector spinae group of muscles to the other. I'm not going past it. I'm not going just around the spine. I'm kind of going almost to the center of the erector spinae group. Not going past it really too much. Staying sort of more towards the center of the spine. So now I'm adding some lime. About 3 or 4 drops of lime, spreading it up. I'm going to, in that, add some another drop of lavender or 2. And here I've got an oil called Balance. This is by doTERRA. Very, very nice oil, this one. Grounding blend it's called. So in a Bowen treatment, how I would use this is I might do what I did just in the introduction to this treatment, which was moves 1, 2, 3 and 4, 5 and 6. I might actually do some moves up the back. I might do 7 and 8, so open the spine. I might even then do a whole range of moves on the back. I might release the traps, release the rhomboids, do levator scapula, do infraspinatus and supraspinatus and the deltoid, and I'll do all my moves at the back of the body. Then I'll do this, and then I'll go work the legs with the Bowen, the rest of the Bowen moves in the legs. So then I might do hamstring procedure, I might release the buttocks, I might go all the way and do the feet and do the calves and do the whole lateral line while the oils are on the back of the body and the body's responding to the oils sinking in, but also to the Bowen moves I've done on the back of the body. What you can also do is you can have a Glad wrap handy, and I don't have any handy at the moment, I just ran out. But what you can do is have Glad wrap handy if you want, especially if you're using a heating oil, like if you're using chamomile to if you're using cinnamon bark to heat the body. If you're going to use cinnamon bark, only use 1 or 2 drops of cinnamon bark. It's a very hot oil, but if you're going to be using and you're wanting to kind of keep that oil heating, if you're going to be using a hot oil and you want to keep it heating, use some Glad wrap. And so what you might do is just rip off a bit of Glad wrap, or saran wrap as you call it in America, I think. Rip it off and put it over the body before you put the sheet down. That'll keep the oils from getting absorbed by the sheet and let them continue to absorb into the body.